It's a problem many don't realize until it's too late. Drug addicts in their darkest hours are unable to find the help they need. FF 12 investigator Devon found it's because of holes in the system in Kansas.
In Kansas, we have ways for drug addicts to get help. Treatment centers, methadone clinics, and support groups are all available. But I found in my investigation they don't always work together well, and it's not one person or organization's fault.
We used to play a lot of games on the N64, especially.
Austin Evans calls his sister a good girl. At least he says she used to be.
When I started noticing the change was when I started noticing my consoles gone.
Back in mid-July, I had an opportunity for a young man to come up to our station to report that his sister had been taking property from him and pawning it at various pawn shops.
Austin had enough with his sister and her boyfriend.
Both admitted that they had been using heroin on a fairly consistent basis. Obviously, we have syringes because they were actually injecting.
Both users, both thieves, and both with parents who never thought this would happen.
I really had high hopes and did very well in school, and she had gotten a scholarship and she had started and going to college, and I thought she was on a road to a very productive life.
Until she wasn't. Cheryl Evans' daughter hit rock bottom, the same place many drug addicts wind up before they decide they want help. But in Kansas, when they do, it's anything but easy.
You're almost losing your mind because you've worked so hard to get to this point where they're accepting it, and then you're being told different things and not knowing what to do.
One thing stood in the way of treatment: methadone. No treatment center would take the addicts because they took too much of the drug meant to get addicts off heroin. I went to the source of that drug, the Matrix Clinic. The owner says methadone is regulated by the state, the feds, and the Drug Enforcement Administration.
And that's why we don't willy-nilly let somebody come in and here's all the methadone you need, walk with Jesus, have a good day. It doesn't work that way.
I went to Valley Hope, the treatment center that was saying no to addicts on methadone. The nursing staff says addicts have withdrawals for days without relief, and that means they get frustrated and leave.
We're not able to keep them comfortable enough in order to keep them in treatment.
Valley Hope can't force addicts to stay, so nurses say they don't.
We can only do so much.
Treatment centers saying no to methadone isn't the only obstacle in Kansas, according to this mother who co-chairs a support group for families of addicts.
Depending on the insurance, sometimes the insurance doesn't want to pay for inpatient. They want to pay for outpatient.
A problem the treatment centers face too.
The feedback that we get is that the patient doesn't meet medical necessity to stay at this level of care.
Then there's the timing issue.
First off, it is, you have to get an assessment, which can take a couple days. So after the assessment's done, it's finding a bed.
She says some other states have fast assessments and admittance, like Florida. But Kansas needs to start talking solutions so addicts can get help instead of getting locked up or getting high.
It's not just any one type of person. Anybody you come in contact with, you don't know.
There are people who want to help. Mays Police Detective Jeff Piper organized an intervention for these two addicts just because he wanted them to have a different ending to their story. But he says he can't do it alone.